Have you ever wondered why a patient might need a chest tube? It's a pretty intense-looking piece of medical equipment, but its purpose is actually quite simple. It's all about making space for the lungs to do their job. Let's dive into why someone might need. 1. Imagine the space between your lung and your ribcage. This is called the pleural space. And it's normally a vacuum, which helps your lungs stay expanded every time you breathe. A chest tube is needed when something that shouldn't be there, like air, fluid, or blood, gets into that space and prevents the lung from fully inflating. Let's start with the first major reason: air in the chest, which is called a pneumothorax. When air gets into the pleural space, it breaks that vacuum seal, and the lung can collapse. This can happen in a few ways. Sometimes, a tiny air blister on the lung, called a bleb, can pop for no obvious reason. This is known as a spontaneous pneumothorax and is more common in tall, thin young adults or people with lung conditions like COPD. Of course, trauma is another big cause. A broken rib, a deep cut, or any penetrating injury to the chest can let air in from the outside or from a punctured lung itself. Then there's the most serious type, a tension pneumothorax. This is a true medical emergency. Air gets into the pleural space but can't get out, creating a one-way valve effect. The pressure builds up so much that it not only collapses the lung but also starts to squash the heart and the other lung, which is life-threatening. Finally, a pneumothorax can sometimes happen accidentally during a medical procedure, like a lung biopsy or placing a central for line. This is called an iatrogenic pneumothorax. The second major category is fluid accumulation. As fluid builds up in the pleural space, it acts like a heavy weight, compressing the lung and making it difficult to breathe. When the fluid is blood, we call it a hemothorax, usually resulting from surgery or a traumatic injury. If it's a general buildup of fluid, it's called a pleural effusion. This can be a symptom of many different underlying issues, like heart failure, severe pneumonia, kidney disease, or even certain cancers. Sometimes, a lung infection gets really bad and spreads into the pleural space, causing a collection of pus to form. This is known as an empyema, and it definitely needs to be drained. A much rarer condition is called a chylothorax, where lymphatic fluid, or chyle, leaks into the chest. This usually happens if a major lymphatic vessel called the thoracic duct is injured or blocked. The third big reason for a chest tube is post-surgical recovery. After any major surgery on the heart or lungs, where the chest cavity is opened up, a chest tube is almost always placed. This is a proactive measure to drain any air or blood that might leak out as the body begins to heal. It ensures the lungs can re-expand properly right after the operation. In some cases, a chest tube is used for a special procedure called pleurodesis. This is done for people who have recurring lung collapses or fluid buildups. Doctors use the tube to introduce a substance, like sterile talc, that essentially glues the lung to the chest wall, preventing future problems. Finally, chest tubes can also be used for diagnostic purposes. If a patient has a large amount of fluid in their chest and a simple needle aspiration is enough, a chest tube allows doctors to drain a larger volume for testing. By analyzing the color, consistency, and chemical makeup of the fluid, they can get crucial clues to diagnose the underlying illness causing the fluid to build up in the first place. So, from emergency trauma to routine post-op care, chest tubes are a critical tool for helping patients breathe. They might look intimidating, but they play a vital role in restoring lung function. Thanks for watching. If you found this helpful, be sure to subscribe to Impulse Eats for more medical explanations.